Hello everyone, myself Mrs.Liba Sara Varghese, Assistant Professor cum Low Vision Specialist of Yenepoya Medical College, Yenepoya deemed to be University. Today we are going to see on the topic history taking for low vision patients. At the end of this session, you will be able to understand what is low vision, what are the objectives of a low vision specialist while observing a low vision patient, and how to take a detailed history taking for a low vision patient. So, when we come to what is low vision, according to the definition of WHO, low vision is a condition where a patient is having a visual acuity of less than 6/60 and a visual field of, for the better eye, and a visual field of less than 20 degrees and not possible with correction with any spectacles or any contact lenses or any surgical or pharmaceutical. So, but I would like to add some other things. For example, the PPT, the slide which you are seeing in the right side is the image of how a low vision person will see, that is overall blurriness for him, and in the left side is what you are seeing is a picture where a normal person will see a visual acuity chart. So, what did you understood from here is, it is not only a visual acuity or visual field is affected, but is also the contrast sensitivity and color vision of a low vision person is affected. Here in this slide you can see the left side is the picture where a normal people like us will see the plate and the food when we are having a food. But in the right side what you are seeing is what exactly a low vision person is going through when he is sitting to eat the food. So, here also you can see because of his low vision, his color vision and his contrast sensitivity is affected. And here in this picture you can see different types of the hemiopic visual field defects and tunnel vision and also overall blurriness, where you can see how a low vision person experience looking at his own mobile phone. So, according to this, what I am trying to tell you is, when a low vision specialist or a low vision person is going to evaluate a low vision patient, we should also keep in mind of color vision and contrast sensitivity along with visual acuity and visual field for evaluating and prescribing devices for low vision patients. Now, coming to what are the objectives we should keep in mind when we evaluate a low vision patient. First, we need to identify patients who can benefit from low vision care and rehabilitation, and also we should evaluate their functional needs. Functional needs means, for example, in the morning when we get up, what is the first thing we will do? For example, if I want to see my face on the mirror, but a low vision person will be a person who cannot see himself in the mirror. And for daily living, what is his situation in his job, or for wearing buttons of a shirt, is he able to do it, or whether he has to depend on someone else for combing his hair. That is the daily functional needs of a person. So, we need to evaluate whether the functional ability of the person is affected or not. Then next is how the ocular and systemic disease has impact on him. Then what is the need for a low vision device? For each particular functional need, we can give each particular low vision devices. So, based on the need of the person and functional need of the person, low vision devices can be decided. Then we should also make appropriate referrals to other professionals. For example, if my low vision patient is coming to me and he is already in depression stage because of the ocular vision is less, and he has come to the category of low vision. So, the first thing I should do, if I come to know he is in depression and he is not ready to have exposure to the low vision devices, then I should refer the patient to a psychiatry department or a clinical psychologist for the session with the psychiatrist. After that, I can start with my low vision devices or the counseling or the rehabilitation services. So we should be ready to give referral for other professionals also for the benefit of our low vision patient. Next, one important thing we should keep in mind is counseling of patient, family and other care providers about visual disability of the low vision patient. Sometimes what I observe in my OPD days is some patients, they will come with their family members. The child who is a low vision patient, the parents will be overprotecting. The parents will be like, I'll do this for you, I'll write on the homework for you, or I will comb your hair, I will dress you up every day. So parent will be too much pampering the child, so child will be always dependent on the parent itself. They will not feel to come out of that shell or even try to come out for being dependent. Like that. But in case of some parents, what happens is, some relatives or parents, they will be like, oh, this is a low vision patient, let him be in that one room itself, let him not come out, or let him not mingle with the society. So they will just put that person in one room itself. So these two categories of the relatives and the patient parties, a low vision specialist will be dealing with. So counseling a patient family and the care providers is very, very important when it comes to a low vision specialist. Next is, before starting with the history taking, one thing what a specialist can do is, we can observe the moment the patient enters into the OPD or the clinic itself, how the patient negotiates his or her visual environment. The way they entering into the clinic itself, we will get an idea how their family is supporting them, whether they are mentally depressed because of the low vision condition or not. So what we have to, how their interaction with their family members, we have to observe their postural abnormalities, their mobility and their appearance. Now we will see each one of it, how to identify. First is their postural abnormality. For example, some patients will come to the clinic. When they enter the room, they will have some head turns or head tilts. Head turns can be because they are having an eccentric fixation, and some patients will have a downward tilt of their head. That is because when they enter the clinic, maybe the illumination of the room, they want a dim illumination, so they are turning their head down because they are having photophobia and glare problem. So while observing them itself, the optometrist or the low vision specialist will get an idea that, okay, this person is having a glare problem or a photophobia problem. And if how the patient is too much depending on the relatives, or he is himself walking in and coming and sitting in front of you and giving you eye contact, that will also give you, as a low vision specialist, will give you a hint of how the patient relationship with the parents or the relatives or the care provider. Next is the appearance of the patient, whether the patient is having any nystagmus or any strabismus, how the person is wearing the dress. For example, if some patients will come, they will wear some color shirt and some color pant, or some salwar where dupatta is in some color which is not matching with the kurta. So what is the hint we are getting is, one thing is their relatives are not supporting them, or the family members are not helping them in selecting the dress, and another thing is the patient is not able to differentiate the colors for the matching the churidar and the dupatta or the kurta. So fatigued appearance, that is, maybe they are not combing their hair and they are just coming the way they are, from their appearance we will get to know whether they are their family members are supporting them or not. Next is sunglasses worn inside the examination room. This is what I also already repeated. The patient might be having glare or photophobia, so they will be continuing wearing the sunglasses inside the room also, and they'll forget to remove it. They want to the sunlight the room illumination of the light room illumination will be hurting their eyes, so they will be continuing it in the room itself. Next is mobility. How the patient is walking, whether he is able to walk without the help of any caregivers, or whether he is having any he is using his tactile sensations, whether he is having a proximity to walls or handrails, how he is using his tactile sensation, he will give us an idea on his mobility. Now coming to the assessment of the functional needs, first is we need to take a comprehensive history. Then in the history, the objective of the history is how the low vision is impacting person's daily life, what he or she wants to do. Every time for my low vision patients, I will be first asking them, I'll introduce myself, and I will instead of asking them directly what is the ocular condition you are having, I'll never do that, because before they come to me they might have gone to so many ophthalms, and repeatedly they will be hearing the same condition, that you are having glaucoma, you are having retinitis pigmentosa, or you are having macular degeneration. These all conditions they will be keeping on repeating, and they will be hearing, and they are already in the depression stage, some patients. So I'll ask them, please give your file, and I'll go through the files, and after going through the files, I'll sit with them and talk to them what are their functional needs, that is from morning till evening what they are doing, and for what they need my help, whether their occupation, what is their occupation, whether their occupation is affected because of low vision, or whether their daily living, some housewife, they will be facing difficulty to cook in the kitchen. So what they need exactly help from me, and based on that I will decide on the low vision devices. Coming to components of history taking for low vision patients, we have so many categories like ocular history, history of previous low vision care, medical history, specific literary requirements, near and intermediate visual needs, distance visual acuity and needs, activities of daily living, independent and travel ability needs, photophobia, glare sensitivity and lightning requirements, social history, employment issues, educational issues, recreational concerns, specific goals or needs. Now you will be thinking, these many history, how to remember? So now we will see each one, and at the last I will tell you how to remember quickly the few important history taking components. First one is ocular history. This is what I said. I don't ask the patient what disease condition you are having. After introducing myself, I'll take their file, I'll go through the files, and I'll see what low vision device they are what ocular condition they are suffering with, and what systemic condition they are having. Everything I'll read in the file itself. I'll ask with the patient how is their vision related. For example, stability of the vision, how was it few months back, and how the patient is feeling right now, whether the patient is taking any medications for the ocular condition, whether the patient is already having history of using spectacles or contact lenses, whether the patient is understanding what kind of visual status he is going through, and whether his family members, anybody is having any of the ocular conditions. Next is, I will be asking about history of previous low vision care, whether he has gone to any other low vision specialist and has already been using low vision devices. If he is using low vision device, I will ask whether it is prescribed by any low vision specialist, or he has seen it in somewhere and he just purchased it, ordered it, and reading the instruction and using it. and what type of device he is using, whether for distance or near or for intermediate. What is the condition of the device right now, whether it is in good stage or whether it is broken, or he is just not using it because of some disadvantage of the device, and what is the task for which the low vision device he is using. Next, I will be asking on medical history. Medical history, what is his general health, whether he is already having diabetes, hypertension or any other systemic conditions. Currently, is he under any medications, whether the patient is having any other disability. Now, low vision is actually coming under the disability category. According to the Government of India, the person is eligible to get a disability certificate if the person is having a certified government ophthalmologist is certifying that patient is having a low vision condition, then he is a certified disabled person. So, is the low vision patient is having any other disability, then if the patient is under any psychological consideration. Next is, as I said, what is the specific literary requirements patient is having. For example, this is for near activities. Reading requirements, whether the patient is a person, someone who will be reading newspaper every day, and because of low vision condition he is not able to do it, and maybe it is a hobby for him. So, because of it he is affected mentally also, like he is not able to continue reading the newspaper, or maybe it is a librarian who lost the job because of the low vision condition. So, what is the need or wish to read specific material? I have also had patients who were telling they stopped using Quran or Bible reading because of the low vision conditions. Then what happens when the patient attempt to read, whether they stopped completely their reading hobby because of the low vision condition, or whether they still try to read and they have done any attempts to continue the hobby. And what happens when they attempt to do it? Is patient able to use own device or read at close working distance, or whether the patient can actually read or what they can read. For example, the newspaper headings or the newspaper content or Bible content, which will have very less point size, letter size. So, depending upon what the patient is reading exactly, we need to know. For children's, I usually ask the parents to get their textbooks or notebooks so that I can know what is the print size. Is the patient is having any eye strain or ocular pain when they try to read, or whether they have any low vision specialist or somebody has already prescribed any talking books for the child or for the low vision patient. Next is other near and intermediate visual needs. Under this category, we can ask the patient whether the patient can perform activities like writing, cooking, viewing the computer, or and when we ask about computer, we should keep in mind about the size of the monitor, what type of work the patient is doing in the computer, how close he is using the computer. From the normal working distance, he has brought it too close to his eyes, or whether he has is still using in the normal distance itself. Any assistive devices, like nowadays so many assistive devices like magic jaws or other things are available which can increase the size of the screen of the letters in the laptop. So, is he already using any assistive softwares? Does patient wear habitual glasses while working on the computer? Next is distance visual ability and needs. For example, distance, how the patient is managing, whether he is able to recognize faces or a relative is coming from far, whether he is having any problem in seeing the face of the person coming opposite to him? Is he continuing watching television, or is he stopped watching television because of the low vision condition? Does he have any problem seeing the bus numbers, or when he travel he is having problem in identifying the bus to catch the bus to go to another places? Or if it is a child, the child is having any problem in seeing the blackboard. Next is activity of daily living. Daily living, as I said, can patient able to do the routine housekeeping duties? So being a housewife, my daily routine morning is getting up, cooking food for my husband and my kids. So the patient will have her or his own daily routine. So because of low vision, how the daily routine activities is affected, we need to ask in detail. Then whether the patient had any rehabilitation consultation for house making skills, or for house making skills is rehabilitationist will help the patient and train the patient by managing the contrast sensitivity in the house. Like for example, while having food, the plate can be of white and the table can be with the black background, so that the contrast sensitivity can be enhanced. So all these, whether they have already gone to any low vision specialist or rehabilitationist and done this in their home or not, we should ask in the history taking time. Then difficulty in self-helping skills or personal grooming. Personal grooming is their own combing their hair, or their how they their daily wear, how they are wearing. All this is coming under personal group, whether they are doing it alone or with the help of someone else. Next is independent and travel ability and needs. Now because of low vision, whether the patient has stopped traveling forever or still he manages somehow to travel. Now coming under mobility, whether the patient is able to travel independently or every time he takes someone along with him and go wherever he want to go. Does patient bump into objects and fall? Any mobility and orientation training he has already got, or does patient uses a cane to go everywhere? How do he travel, or are there any difficulties in traveling? And in case of driving, if the patient loves to drive, that was his hobby, and because of this condition he has stopped his hobby, does the patient still drive? Whether because of still he is driving with his ocular condition, he has met with accidents, whether the family members support driving, or patient has stopped driving or limited driving, is the public transportation available? So this is one thing where a low vision specialist has to keep in mind. Every government places, like for example railway station, if a low vision person is showing a disability certificate, there is concession for the railway tickets. These kind of informations are not aware to the public low vision patients. These can be shared by a low vision specialist to the patients. Next is photophobia, glare sensitivity and lightning requirements. Patient will have, is the patient having difficulty looking at the sun? Patient is having difficulty with light in the indoors, also in the room. Some patients are there, they will put more lights in the room. Some are there, they off all the lights in the room. That means they are having photophobia or glare. Some want more light, that means they are not, the current light is not enough for them. So such kind of patients, sometimes I ask them to fix extra tube lights in their room, or carry always a torch with them, or keep a table lamp on their study table or the table they use in their room. So whether they have any difficulty in changing from different light levels, for example from outside to inside when they enter, how they feel, whether they have pain in their eyes, or they feel like suddenly when they change the lighting conditions, how they are feeling. Any use of sunglasses, If they are using sunglass, what color they are using and what type of sunglass they are using and who has prescribed it, or whether the patient use a cap. Some patients are there, they don't go to any ophthalmologist or optometrist, they'll be busy with their daily life activities. So when we ask them, do you have problem with light, they might not be able to tell us, yes I have, but what we observe is they'll be wearing a cap inside the clinic itself. So that cap represents that they have a problem with the light. Next is social history, how they are with their family members. First is about his family status, marital status, whether the patient is married or not. If married, how the wife is a helping person, or because of this low vision condition his wife has left him or husband has left her, or how many number of dependents are there in the house. For example, mother, father, wife, brother, the number of people are more for helping him, or there is nobody is there in his house to help him or her. Then family interactions, how motivated is patient. Some patients are there, once they get this kind of low vision conditions, they will just sit in one room, they will not come out or mingle or social with others. They will be like, I'll be forever, I'll sit in this room itself. That kind of mentality patient is having, or patient is motivated to get some help from others and go ahead in the life with the disease condition itself. Then is patient having family or friends for support. So because of their social, they will be not interacting with others, they will slowly start the number of friends and the relatives will reduce for them and they will just sit in one place. Social isolation, it will happen. So what is the current stage? Patient is already in that social isolation, or the patient is ready to go ahead with the disease condition and interact with his family members and society. Emotional status, how patient is adapting to the condition. Emotionally he is in depression, or he is ready for a low vision device and to go ahead with his life. If he has any kind of signs of clinical depression, we have to refer him for a psychiatrist or a clinical psychologist for further for sessions for the depression as well. Next is employment issues, whether the patient is still employed, he was doing any volunteer work, or he was, because of this condition he lost his job. That is a very important question we need to ask. What type of work he is doing, or did patient leave the job because of the condition? Is the patient seeking now for the employment? Some patients are there, they will lose job because of the ocular condition, low vision condition, then they will be looking for another job which they can do in their house itself or nearby, they can do with whatever residual vision they are having. Any visual requirements they need for job, particular job, that also we need to suggest them. And in what type of job they are in, we should also give them appropriate protection should be given. The protection for occupational protection glasses, that comes under, like for example, if I can say people who are working lot of time with computer, they are suggested to use blue cut lenses or pink tinted glasses, so that it can give some soothing effect to their eyes, so the eye strain can be reduced. So what this kind of job low vision patient is looking for, that if it requires any occupational hazard, if it is related, then we can suggest for appropriate protection wearing as well. Next is educational issues. So this will come most for the pediatric age category when they go to school. Is child attending regularly school? How is his academic performance? Academic performance is going down because of the ocular condition. Can child copy directly from the board, or somebody has to sit next to him and write? How is the child's sitting position? Are teachers or peer members are helping him? What kind of help teachers are giving? What is the interaction between teacher and the child? Does the student use large print tools? If it is used, then who has given it, or how the child is using it? Then what is the condition of the tool now? Is there any mobility or transportation problem in attending schools? Child is already using any audio books or magnification devices or not? So these all kind of questions we need to ask in detail. I used to give even letters to the school teachers, how they can be with the child, and how the child's education can be improved in the school. Next is recreational concerns. This is, everybody will have a hobby, right? So what is for recreational activity, what that person is doing? Suddenly they got a low vision condition, so they should just stop their world because of this condition. I am not a person who is supporting that. Whatever the patient wants to do, a low vision specialist should do maximum to support for the patient to continue it. So what is the hobby of the person? And based on the hobby, whether it is writing, maybe some will say watching television, whether it is, maybe some will go say about traveling, some will tell about drawing, painting, whatever their hobbies are, we should maximum try to help them to continue the hobbies. So these were the recreational concerns and specific goals. Specific goals also will come under the recreational concerns itself. For example, my specific goal is I am too much into my pets. So what I can do to improve that or continue that, that's it. So specific goals or recreational concerns. And also specific goals, last one question we used to ask to the patient is, this much time I was speaking with you, I understood what you are going through. So your specific goal or need is for distance or for near, right, or for intermediate, right, or for doing this or that, like kind of conversation I am usually having with my patients and get the idea on what they exactly want, and based on that low vision treatment or devices can be prescribed. So now you might be thinking how we will remember all these. It will take some 2 hours talking to the patient itself for history taking. So these are some few steps. Let's go step by step. Few steps you are there, you keep in mind. So this will help you for have a good history taking with your low vision patient. First you observe the patient. Observe whether they are having any postural abnormality, they have any mobility issues, and what is their appearance. Then introduce yourself. Then you go through their medical records. Then ask for their functional needs from daily morning, how when they get up till go to sleep, what they are doing in their daily life, and how you see how can you help them to continue their daily needs or functional needs. Then ask questions related to distance. Distance means, are you able to recognize a person walking from across you, or while traveling, are you able to see the menu special which is written in the hotel board. So these are some questions related to distance. Then ask questions related to near, whether they are continuing the near reading or they stopped their hobbies like reading Bible or reading Quran or reading their religious this thing, or their near activities, whether they stopped or still they are, how they are doing. Then questions related to light, they want more light or they want less light. Then questions related to traveling, whether they stopped traveling because of the low vision condition, how they are traveling, still they are asking others help for traveling, or they are able to go everywhere themselves. Then last is question related to education and their occupation. whether they are still working or because of the low vision they stopped working and always depending on others, they are ready to work in future or not. So these many are the few steps you keep in mind so that your history taking for low vision patients can be improved a lot. And low vision is, do not consider it as a disability, treat these patients as a people with special abilities. If there is a will, there is definitely a way. Tell them there is a way and you give them confidence. When you give them confidence, they feel like yes, with this disease condition I can go ahead and live forward in my life. So this is about history taking of low vision patients. I hope all of you enjoyed, understood the session. Thank you so much.